Very good morning. Today we'll study the facial muscles, the muscles of your face. Now, the facial muscles are basically the muscles of facial expressions. They bring about different facial expressions. Whatever you express, they bring about those expressions. These facial muscles, whatever the muscles present on your face, they brings about the facial expressions. Now, embryologically, they develop from mesoderm of the second branchial arch and are therefore supplied by the facial nerve. They are developed from the mesoderm, so that's why they are supplied by the facial nerve. Morphologically, they present the remnants of panniculus carnosus, a continuous subcutaneous muscle sheet seen in some animals. Okay, now all of them are inserted into the skin only. This is the remnant of panniculus carnosus. Now, topographically, the muscles are grouped under the following 6 heads. We have different 6 groups of facial muscles are grouped under the 6 heads. So, the first is the muscles of scalp. Your scalp, the muscles of scalp, first group, in which it comes the occipitofrontalis. Means the muscles which starts from your occiput to the frontalis. So this is your first muscle. This occipitofrontalis is your first group of muscle, the muscle of scalp. Now, the second group is the muscles of auricle, means the muscles of your ears, around the ears. Whatever muscles which are present around the ears, that comes under the this your what you can say, your the muscles of auricle. So there are 3 muscles which comes under this group, muscles of the auricle: the auricularis anterior, auricularis superior, and auricularis posterior. These are the 3 muscles which auricularis anterior, auricularis posterior, and auricularis superior. This is the 3 muscles which are present around the auricle, around the ear. Now, next is the muscles of eyelids. Now, the muscles of eyelids are the orbicularis oculi. First is orbicularis oculi. Second is corrugator supercilii, and the third is levator palpebri superioris. So this is the muscle. These 3 muscles come under the muscles of eyelids. Okay. Now, the fourth muscles which will come under the fourth group of muscles which will come under this this facial muscle is the muscles of your nose. The muscles which are present around your nose. So 3 muscles in the eyelids, these orbicularis oculi, corrugator supercilii, and levator palpebri superioris, and the fourth group is the muscles of nose. Then there in these muscles of nose, four muscles are present which comes under the muscles of nose. What are those 4 muscles? The procerus, the compressor nares, the dilator, what you can say, dilator nares. The muscles which are comes near your nose are called as the they are termed as nares because they are present near the nose. That's one nares. So procerus, compressor nares, dilator nares, and depressor septi. Depressor septi here. So these muscles are present around your nose. Now, muscles around your mouth. The 5th group is the muscles around your mouth. What are the different muscles which are present around your mouth are? Because see, when they are present near the eye, so they are named as oculi. When they are present near the nose, they are termed as nares. When they are present around your this mouth, they are termed as this oris. Okay, so accordingly they are named accordingly where they are present. Now, what are the different muscles which are present around the this your mouth are, first is orbicularis oris, then levator labii superioris aliqui nasi. These are the muscles of lips. This levator labii superioris, levator labii uh, aliquinasi, levator anguli oris. These are your muscles of your lips, which are comes and labii. Okay. Now, next is zygomaticus minor and zygomaticus major, the two major muscles of your zygomatic arch. So this will come under the zygomaticus major and minor. Okay, these are the six. Then seventh muscle is depressor anguli oris, which will depress the angle of your mouth. So it will come under the depressor anguli oris. Now next is the depressor labii inferioris. Okay, then the mentalis present here. So next is mentalis, and then is risorius. Next muscle is your risorius. So then there is muscles of buccinator. One more muscle is there around the mouth is the buccinator. So basically there are 11 muscles around the your mouth. The orbicularis oris, levator labii superioris aliqui nasi, levator labii superioris, and levator anguli oris, zygomaticus minor, zygomaticus major, depressor anguli oris, depressor labii inferioris, mentalis, and risorius and buccinator. These are the 11 muscles which are present around the mouth. Okay. Now, next is the muscle of your neck is the platysma. So these six groups are the muscles of your facial muscles. Okay, your muscles of your face. First is the muscles of your scalp, then muscles of auricle, then muscles of nose, then muscles of this eyelids, then muscles of your mouth, muscles of your neck. This all these groups will come under your this muscles of your facial muscles. Now, what is the functionally the most of these muscles may be regarded as the primary as regulators of three openings situated on the face. Basically these all muscles are the function around these three major openings which are present in your face. Those are the palpebral fissures, the nostrils, and the oral fissure. Palpebral fissure means the opening of your eyes, means your eyelids are opening, means this is also your opening. Then your nostrils, okay, and then your oral fissure is this your mouth. Okay, now each opening has a sphincter and a variable number of dilators. Okay, sphincters are naturally circular and the dilators radial in their arrangements. Sphincters means which closes these openings, and dilators which opens this openings. Okay, now the muscles are better developed around the eyes and mouth than around the nose. The muscles which are present around the mouth and eyes, we can express through these eyes and nose. So these muscles are more developed, especially the muscles of mouth. You can say um, how hard you chew, your muscles will develop. Okay, so the muscles around the eyes and mouth are more developed rather than your muscles of your nose. Now, what are the functional groups? Like this is the table which is explaining the various functional groups of facial muscles. The palpebral fissures means the opening of your eyes, and then the oral fissures and the nostrils. These muscles are explaining the various, what you can say, the this your various openings, the functional groups of facial muscles. Like opening is palpebral fissure. Sphincter means which is closing your mouth is orbicularis oculi, and the dilators which is opening your eyes are levator palpebrae superioris and occipitofrontalis, especially this muscles, which brings about this expression, this horizontal opening, horizontal lines. So this is the palpebral fissure muscles. Okay. Now, second is oral fissure. Orbicularis ori is the sphincter of oral fissure, your mouth. Okay. Now, orbicularis or oris is the opening of your this oral fissure, and dilators all the muscles around the mouth except the orbicularis oris and the mentalis. Okay, these two muscles are the other muscles, all other levator muscles, all your all your levator labii muscles, zygomaticus minor, major muscles, depressor anguli muscle, depressor labii muscle, buccinator, risorius. All these muscles are the dilators, which opens the mouth. Okay. Now, with the muscles which closes the mouth is orbicularis oris. Only one muscle closes the mouth, and then the other muscles, except orbicularis oris and mentalis, the opens the mouth. Now, next is the muscles of your nostrils, means the openings of your nose. So, the sphincter which closes the muscle is compressor nares, and the other muscle is dilator nares, depressor septi, which the dilators are dilator nares, depressor septi, medial slip of levator labii superioris aliquo nasi. Okay, these are the muscles of your dilators of your nose. Okay, now next is the what are the frontalis muscles. Will see the different muscles in details in on pictures on the images. Okay, now the next is the few common expressions. What muscles will bring about what expression on your face? What are the various expressions? You have different expressions of frowning, exclamatory, depression, sad, happy. All these expressions are developed by various facial muscles. So the this your muscles are, which are the common facial expressions, and what muscles are controlling them are is here in this slide. You can see. So the various muscles are, now smiling and laughing is done by zygomatic major. This if when you are smiling and laughing. So these two expression is controlled by zygomaticus major, the basic muscle of your this you can say cheeks. So this smiling is done by zygomaticus major. Next is sadness, levator labii superioris and levator anguli oris. Sadness, when you are sad, you are having no expressions and you're feeling low. So when these muscles will act, means it's like not always acting of when zygomaticus major is on the you can say antagonist level, and levator labii superioris is levator anguli superioris is uh, working when levator anguli superioris is working, and this levator anguli labii superioris is working. So this is the muscles of your this sadness. Now next is the muscles of your grief, which brings about the expression of grief is the depressor anguli oris. Okay, now anger, dilator naris and depressor septi. Anger is dilator naris and depressor septi. This is the muscle of your anger. When you show anger to someone, so these two muscles, the dilator naris, like your nasal flares are opening, dilator and depressor septi, these two muscles work when you show anger to someone. Okay, now corrugator supercilii and procervis. When you are frowning, when frowning means, then we are doing this expression. This is by the corrugator supercilii and procervis. Okay, now the horror, terror and fright. Horror, terror and fright. This muscles, the platysma controls this horror, terror and fright expressions. When you are afraid of something, or you are in डर रहे हैं, and fright is when you are किस चीज़ आप कुछ छुप के देखते हैं जब कोई horror movies, when you see, so then you at that time you just feel the expressions on at that time is this platysma. When you are afraid of something, that is means when you are in expression of डर, so at that time the platysma will work. Okay, now surprise is, oh wow, this is surprise. So frontalis will work at that time when you are in this surprise position. Okay, now doubt is by mentalis. When you are in doubt something, you are feeling, you are in doubt something, so at that time mentalis will work. Now grinning, risorius. Okay, grinning content zygomaticus minor. This 10 expressions are covered when you go for this different expressions, then different muscles will work. So these are the different muscles when you show various expressions on your face. Now clinically, the facial nerve is examined. How the facial nerve, these all muscles are supplied by the facial nerve. The 7th cranial nerve of your all the 12 this is the 7th cranial nerve. Facial nerve is your 7th cranial nerve. Okay. Now the facial nerve is examined by the following facial expressions. Means what you have to ask to patient, and then what response he will give, and then what are the various muscles which are working or not. You can check through various, if you ask patient to do various activities on your face and they are able to do or not, it will come under the your expression of facial muscles. Means how intact is your facial nerve. So first is the frontalis. Ask the patient to look upwards without moving his head and look for the normal horizontal wrinkles of the forehead. Okay, now frontalis is present here on your head. Okay, so when you will ask the patient to look upwards like this and see the horizontal lines, these horizontal lines which are present here on your forehead, this will come under the checking of your frontalis, where your frontalis is intact, innervated or not. Okay, this will come under this. Okay, when this facial expressions are जब आप ऐसे ऊपर देखेंगे कहेंगे पेशेंट को, at the time you will check कि ये horizontal lines proper आ रही है कि नहीं, so that कि your facial expressions are your frontalis is intact, innervated or not. Next is corrugator supercilii, frowning and making vertical wrinkles of the forehead. Vertical wrinkles means this corrugator supercilii. If you'll ask the patient to show this the vertical lines. This vertical lines is by the your corrugator supercilii, or the vertical wrinkles of the forehead. Now Orbicularis oculi, tight this. Okay, orbicularis oculi, tight closure of your eyes. When you tightly closes the eyes, see, then your orbicularis oculi is intact. Okay, now next is orbicularis ovis, whistling or pursing the lips. This is when you do. So this is whistling and pursuing. So this muscle is by orbicularis oculi. Okay, now dilators of mouth showing the teeth, and various other dilators, levator superioris, and all these dilators, when you show your teeth, is your dilator is working or not, your other dilators of your mouth is working or not. Okay, now the buccinator of your buccinator is present or not. Now how you will check the buccinator? Puffing of mouth and blowing forcefully. Puffing of mouth and then blowing forcefully. This, when you fill air in your mouth, जब आप you do this, this is your buccinator is working or not. Okay, now next is the platysma, forcefully pulling the angles of mouth downwards and backwards, forming prominent folds of the skin on the side of the neck. See, this is your contracts with the risorius. That's when you are doing this. So this muscle which are working, this vertical folds of the skin on the neck, the side of the neck, this is your platysma is present there at that time. Now the facial muscles and their various expressions are now this chart will show where the facial muscles are working or not. Okay, now next is your the facial muscles. Muscle, the corrugator supercilii, origin, medial. Now what are the various origin, insertion and action of your facial muscles? Now the origin, corrugator supercilii, your corrugator medial end of superciliary arch, skin of the mid eyebrow, and action is the vertical wrinkle of your forehead, frowning. This is the action of your corrugator supercilii. Now orbicularis oculi, the three parts of orbicularis oculi is the orbital part, palpebral part and the lacrimal part. Now the lacrimal orbital part taking origin from medial part of medial palpebral ligament adjoining bone. Okay, then it is inserted on the concentric rings, returned to the point of origin. Okay, it is the concentric. The orbicularis oculi are the concentric rings. They are present in the form of rings. Okay, now what is the action? Closes lids tightly, winking protects the eye from bright light. Okay, now see, next is the palpebral part in the lids, the lateral part of medial palpebral ligament. Okay, lateral palpebral raphe, closes lids gently and blinking. So this closes the lids gently and blinking. This is the action of this palpebral part. Next is the lacrimal part, lateral and deep lacrimal sac. The lacrimal part take origin from the muscle of this orbicularis oculi muscle, lacrimal part. This origin from the lacrimal fascia and lacrimal bone. Upper inserted on the upper and lower tarsi. Dilates lacrimal sac, directs lac puncts into lacus lacrimalis, supports the lower lid. This is all about these actions of this lacrimal part. Is the it dilates lacrimal sac, it directs lacrimatic, this puncts into the lacus lacrimalis, supports the lower lid. This is about this lacrimal part of orbicularis oculi. Now, orbicularis oris, the intrinsic part and the extrinsic part. There is two parts of orbicularis oris. One is intrinsic and the other is extrinsic. So, intrinsic part is the deepest stratum within sheet, very thin sheet. Okay. Now, superior origin is from superius incisivus. The origin is from the superior incisivus, from maxilla, inferior incisivus, from mandible. It takes origin from orbicularis oculi. Intrinsic part takes origin from superior incisivus, from the maxilla, means, and the inferior incisivus from the mandible. From these two places, from maxilla also and mandible also, this orbicularis, the intrinsic part of orbicularis oculi takes origin. Now, its insertion is on the angle of mouth. This is your angle of mouth and it's inserted here. Okay. Now, closes and purses the mouth. Numerous extrinsic muscles make it most versatile for various types of grimaces. Its numerous extrinsic muscles make it most versatile for various types of grimaces. Means, so this is the angle of mouth. Okay. Now, and this the closes and purses the mouth. This is the action of your orbicularis oculi intrinsic part. Now, intrinsic and also extrinsic. The extrinsic part, two strata formed by the converging muscles. Okay. Now, thickest medial stratum derived from buccinator, thick superficial stratum derived from elevators and depressors of the lip and their angles, lips and the angles of the mouth. It is around inserted around the lips and the angle of the mouth. So these are the various orbicularis oculi, the both parts, the intrinsic part and the extrinsic part. This you can say expressions. So next is the buccinator muscles. Buccinator muscle of the cheek. Buccinator is the muscle of your cheek. When you blow out, this will come out. So this is the muscle of your cheek. Now, the upper fibers from maxilla opposite molar teeth. This opposite molar teeth is the upper fibers of maxilla. Lower fibers from the mandible opposite molar teeth, and middle fibers from the pterygomandibular raphe. So this buccinator muscles take from the upper fibers, middle fibers and the lower fibers. Okay. Same as they are also inserted on the this areas, like upper fibers straight to the this your upper lip, lower fibers straight to the lower lip, and middle fibers decussate before passing into the lips. They divide into two and before passing the lip. So this is the insertion of buccinator muscle. Now, flattens. What is the action of this buccinator muscle? It flattens the cheeks against gums and teeth, prevents accumulation of food in the vestibule. So the action is basically it flattens the cheeks against the gums and teeth and prevents accumulation of food. This is the most important, because your food should not get accumulated in the vestibule also and in the mouth also. It should get moved from the mouth. So this is the basic action of your buccinator. Now, next muscle is the platysma. Origin is the upper part of pectoral and deltoid fascia, and your what you can say anterior fibers to the base of the mandible. anterior fibers inserted on the interior fibers to the base of the mandible, posterior fibers to the skin of the lower face and the lip, and maybe the continuous with the res aureus. The release of pressure of skin on the vertebral adjacent veins depresses mandible, pulls the angle of the mouth downwards as in the horror or surprise. This is the action of your platysma. Now, next is motor nerve supply of the facial nerve, facial muscles. How the facial muscles are supplied. So, facial muscles are supplied by the facial nerve is the motor nerve of the face and its 5 terminal branches. There are the 5 terminal branches of your facial nerve. First is the temporal, zygomatic, buccal, mandibular and cervical. These are the 5 motor nerve supply of the face, emerge from the parotid gland and diverge to supply the various facial muscles. This is the facial muscle of your facial nerve which supplies the motor nerve of the face. Now, next is the cutaneous nerve of your cutaneous nerve supply of your face is ophthalmic division of the trigeminal nerve. It supplies the cutaneous nerve and the area of distribution. Okay, from where the source is, the various skin is supplied by the 4 cutaneous nerves: the ophthalmic division of trigeminal nerve, the maxillary division of trigeminal nerve, mandibular division of trigeminal nerve, and cervical plexus. Okay. Now the cutaneous nerve. Ophthalmic division of trigeminal nerve supplies what are the cutaneous nerves from this ophthalmic division of trigeminal nerve is the supratrochlear nerve, supraorbital nerve, lacrimal nerve, your infratrochlear nerve and external nasal nerve. These are the 5 cutaneous nerves from the ophthalmic division of trigeminal nerve, and the area of distribution are the scalp up to vertex, forehead, upper eyelid, conjunctiva and root and dorsum and tip of the nose. These are the area of distribution. Okay, now next is your maxillary division of trigeminal nerve which supplies the this is the source, maxillary division, and the infraorbital nerve, zygomatico-facial nerve, zygomatica-temporal nerve are the cutaneous nerves. Okay. Now the supply is the lower lip. The upper lip is supplied by the maxillary division of trigeminal nerve, and the lower lip is supplied by the mandibular division of the trigeminal. Basically, trigeminal nerve supplies the cutaneous, the skin of the face. Okay. Now lower lip, chin, lower part of cheek, lower part of jaw except over the angle of the and lower margin, upper tooth of the lateral surface of auricle and side of the head. This all is supplied by your this mandibular division of your trigeminal nerve. Now, what is the cervical? The source is cervical plexus, and the cutaneous nerve which supplies this face is the interior division of great auricle nerve and the upper division of transverse cutaneous nerve of neck. This 2 portion is supplied by this your cervical plexus, your cutaneous nerve. Okay. Now, area of distribution: skin over the angle of the jaw and over the parotid gland, lower margin of the lower jaw. This is supplied by the cutaneous nerve of the face. Now, these are the various. See, this picture shows the various muscles of the head that produces facial expression. Now it's a pictorial portion. Now you can see here are the say orbit and eye muscles, orbicularis oculi and corrugator supercilii, origin from the medial wall of orbit, medial end of superciliary arch of frontal bone, insertion circular path around the orbit and skin of the eye. Action closes eye and the draws eyebrows inferiorly and wrinkles skin of the forehead vertically as in the front. Now, muscles of the head that produces facial expression. Now, see in this picture, you can see the where these present muscles are present. Okay, see now when they contract, muscle facial expressions move in the skin rather than a toy. Epicranial aponeurosis. This is epicranial aponeurosis. Now, this is this muscle, your occipitofrontalis. Here, you can say this. Say occipitofrontalis here. Okay, this is the occipitofrontalis. Then this is orbicularis oculi. This comes under the regular, you can say, circular rings. They have said as circular rings. So this is orbicularis oculi. Now next is your levator labii superioris. Your levator labii superioris is this. It is showing here, levator labii superioris. Now, zygomaticus major and minor. The upper one is the minor and the lower one is the zygomaticus major. These are the two facial expression muscles. Now, next is the risorius. Okay, the risorius muscle here it is present. You see, I can show on my face. Look, see, this is orbicularis oculi, frontalis. Now you can see the levator labii superioris here. Levator around this area is levator labii superioris. Now the zygomaticus major and minor here, major and minor above and the major down. Then risorius. Okay, then platysma. These are the muscles of your expression. Now on the other side you can see the corrugator supercilii. This corrugator supercilii. Okay, levator palpebri superioris, levator palpebri superioris, lacrimal gland, zygomatic bone, nasal cartilage. This nasal cartilage is here. Now maxilla is this area. Now levator anguli ocular oris. Here is your levator anguli oris. Okay. Now buccinator, which brings about this puffiness in the mouth, is the buccinator. Okay. Now masseter is the muscle of your mastication, which is present here. Masseter, the superficial muscle. Okay, this is the superficial. Whatever I am showing on your right side, rather my right side, is the superficial, and these are the deep muscles. Here this side is deep muscles and this side is the superficial part. Now this is mandible. This is the angle of mandible. Okay, omohyoid, sternohyoid muscles are present here, and this is, you can see this side muscle is your sternocleidomastoid. The prominent muscle is your sternocleidomastoid muscle. So these are the various expressions. Now you can see the same on the these muscles from the side. Okay. So you can see okay. Next is your the muscles from you can see from the side of your this lateral view. Okay, so it is shown here under lateral view, how the lateral view is seen. See occipitofrontalis, from occipit to frontalis, the lateral view is you can see the muscles from the lateral side. Okay, then zygomaticus major, minor, all the muscles here, the masseter, the muscles of your mastication, all these muscles are the small muscles which are present around the face and which brings about the various expressions. Okay, nasal muscle, zygomaticus major, minor muscle here, zygomaticus major, minor muscle. So these are the various muscles which are present, and you can say these are the muscles of your facial expressions. In this you can see the muscles of your mastication. Muscles of your mastication, there are more 4 major muscles of your mastications. See, the major muscles of your mastication is the temporalis. This your, see, when you chew, see, one is your temporalis. Okay, then lateral and medial pterygoid is the internal muscles in your face, lateral and medial pterygoid. Okay, and your masseter. These are the 4 basic muscles of your your mastication: the temporalis, lateral medial pterygoid, and the masseter. These are the muscles of your this mastication. Where the other things which are present in this it's showing is the this buccinator around the face. Here is the buccinator. Okay, orbicularis because they are present in the, you can see in the concentric rings. They are in the forms of concentric rings. That's why orbicularis oculi. Body of the mandible, then ramus of the mandible, or these are the ramus of your mandible. It is cut here. These 2 are the ramus of your mandible. Okay, so these are the various facial muscles and various facial expressions which are bring about by the various muscles of the superficial muscles and the deep muscles and the muscles of your mastication. They bring about various expressions on your